Spanning more than 41 hectares on Bali's southeast coast, the Sanur Health Special Economic Zone is designed to be Indonesia's first ever integrated health tourism destination.
This is the only hospital in the SEZ. All the other facilities in the complex are clinics, spanning over 67,000 square meters. It offers cardiology, oncology, neurology, gastroenterology, hepatology, and orthopedic services, strengthened through partnerships with Australia, Japan, and Singapore.
2 million Indonesians travel overseas each year for medical care, with 74% choosing Singapore and Malaysia. Contributing to more than $9 billion in annual spending abroad, the Sanur SEZ aims to reduce that outflow.
For the first time in the history of Indonesia, international specialists, both in both doctors and also nurses and also any other allied healthcare professionals, they are able to practice with practice licenses in Indonesia, but restricted to the special economic zone. Many of the outbound Indonesian medical health seekers, they leave the country precisely to access professionals like this.
As a national strategic project, the Sanur SEZ will feature facilities for stem cell therapy, aesthetic surgery, fertility treatments, ophthalmology and geriatrics, alongside premium accommodations and an ethno-botanical garden.
So have the data. That's why for our bidding process, selecting the partner, about 3 years ago, we searched and curating one by one 300 something clinics that we see and talk to the doctors, because we believe that to bring the international top-notch brand is the answer.
Indonesia has a shortage of around 70,000 specialist doctors. Authorities want to fill that gap and lure highly skilled members of the diaspora back home.
Dari dokter-dokternya mungkin di Indonesia nggak kalah, tapi sistemnya mungkin yang di sini harus diperbaiki ya. Dan mungkin itu yang kita bisa ambil kayak shortcut. Kalau ada orang yang dari luar dan orang Indonesia yang paham juga Indonesia seperti apa, bisa dibawa ke sini mungkin untuk bisa mengadaptasi sistem internasional yang bisa dibawa ke Indonesia.
Southeast Asia's medical tourism sector is valued at more than $48 billion. It is expected to expand by over 12% annually. And Indonesia is looking to boost its GDP with a share of that growth.
At the moment, the 2 million Indonesians that travel abroad is equivalent to about 150 trillion. So because we're opening things in stages, we're hoping to, at the first year, curb maybe 1/3 of that. So we'll be looking at 50 trillion, curbing that. And then if we look at 3 years, maybe we'll go into about the 200 trillion, because we managed to curb, but then also we'll bring in from abroad.
Indonesians currently make up 40% of the hospital's registered patients, with the remaining 60% consisting of foreigners from more than 30 nationalities. The project also aims to boost the local economy by employing local workers, targeting 12,000 jobs within the next 3 years. Authorities have high hopes pinned onto the project, and the coming years will determine if Indonesia's ambitious plan will deliver the desired results. Chandni, Vatvani, CNA, Bali.